much for watching this video, this broadcast. We're going to be talking all about today heart disease. So helping you to better understand what is heart disease, um, how does it work, as well as also what exactly do you need to know about it when it comes to the NCLEX, right? So if you want to better understand how heart disease is, what it is in more detail, then make sure that you stay to the very end to watch this video. Hey, so before we move on, one thing I want to mention is that, it's really important to be able to stay awake, stay alert, right? And sometimes you want to do that without the crash and the burn that comes with like coffee and other things. So I want to recommend to you our energy shots here. These are all totally natural ingredients, okay? And it also contains like B6, B12. It does have caffeine in it, so it's gonna wake you right up, and it comes in both grape as well as orange. So these are our energy shots. Just click the link below this video and use the code that's included below the video, and you'll be able to get it at a special deal. You'll get a full pack, and this really lasts honestly for like a long time, and it tastes excellent. All right, so let's talk about coronary artery disease, coronary heart disease. So we know that heart disease is one of the leading causes of death in the United States. You know that, right? So it's actually, I want to say number one. So it's more than cancer. So number one is heart disease because unfortunately we're stressed and we're overeating, eating too much McDonald's. And then number two is cancer. And then number three are medical errors, right? That's a whole other broadcast. Okay, so we're talking about heart disease. Understand what heart disease is and what you need to know about it. The biggest thing you need to first understand is the pathophysiology. If you don't understand pathophysiology, then you're going to confuse this disease process with other disease processes. Okay, so this is essentially a problem where there are arteries, right, inside the patient's heart, right? And so when somebody consumes too much like plaque, or I should say, I'm sorry, fatty foods, oils, that type of stuff, foods that are just pretty much not good for you, what happens over time is that the arteries in the heart begin to fill up with plaque. That's what that yellow stuff is in the video. And so then eventually the patient will begin to complain of chest pain, right? So they'll have this chest pain and it will be like a dull, achy feeling. And the chest pain could indicate that it's just honestly the occlusion, meaning that it's the coronary artery disease, but it's not a heart attack. If it's a full-blown heart attack, the patient would be way more symptomatic. So meaning that they wouldn't just complain of their chest hurting, but they would also be having like nausea, they'd be throwing up, they would be very sweaty, they would be clutching their chest. That would be a full-blown heart attack. So with heart disease, this is where that plaque is building up, building up, building up. And the problem is that it's not really reversible. Usually it can be reversed, or not, we may say reversed, it can be prevented and improved through when they have like a stent procedure done. And so let me kind of show you a little bit what a stent looks like. This is where they pretty much put like a catheter in between the artery wall, and that helps to open it up. And then that helps to create more blood flow through the arteries. So, and there's some patients may have more than one stent placed in order to help with that blood flow. So that's essentially what it is where they put a stent in, a balloon in, and this is what you call a cardiac catheter procedure. So let me actually see if I can type it on here for you guys. So cardiac catheterization. All right, cardiac nice and big right there. Cardiac catheterization. So with the cardiac cath, that's another topic, but that's pretty much where they have to go in and stick that balloon in, and that opens up the arteries in the heart, so that way it starts to perfuse and they begin to get adequate blood flow. Okay, so here's some of the things though that you want to remember, or as far as very specific um, points when it comes to the test, is coronary artery disease. It's a waxy substance called plaque that builds up in the coronary arteries, which are the arteries in the heart. And these arteries help to supply oxygen-rich blood to the heart muscle. So the pain that they have or that they complain of, that is what we call angina, right? So let me put on here. So we have angina, right? So there's different types of angina, right? There is stable angina and there's unstable angina, okay? And then there's like a true blown heart attack. So stable angina is where they have the chest pain with exertion, um, versus unstable angina, they're having the chest pain no matter what they're doing. So they're pretty much having it at rest, which is a sign that it's not good, it's not improving. So when it comes to patients that have heart disease, we have to really educate them, right? Decrease their stress levels, right? I myself included, decrease their stress levels, cut back on, fatty foods, more fruits and vegetables, so that way it doesn't develop into a full-blown heart attack, which can result in much more worser symptoms, right, for the patient. So these are some of the things you got to be thinking about is, okay, what's the actual pathophysiology of the disease process? Not just what it is, but what's the pathophysiology? What makes this different from other types of disease processes? If this is something that you feel like is way in over your head, to be honest, then take advantage of some of our resources I posted here on the screen for you. We have physical books and then we have ebooks. And so from left to right, we have our farm cheat sheet book. We have a book on also how to become an RN. The 7 Diseases Guide in there, that's what you're probably going to find the most helpful as far as the topic I'm going over today. And then also how to study the NCLEX. So you can always text the word NCLEX help to the number on the screen, 470-761-4735, or go to our website in order to get access to the books. Okay? So that's essentially, in a nutshell, what coronary artery disease is, as well as also what it looks like. Now, what I'm going to do, I'm going to play really quickly for those of you interested in maybe you're more, you want something a little bit more digestible, like maybe you're looking for more video trainings where I talk about heart disease, or even like slides that breaks it down for you, like you want something that's even more comprehensive than only, the books or ebooks, etc., then go ahead and stay tuned and watch this quick video where I'm going to explain a little bit more about that. So if you're finding this video really helpful, then you're going to absolutely love our courses. So we have an RN prep course, as well as also a LPN prep course. So just to show you a little bit inside of the course starts off where you will take a pre-test. So there's a pre-test as well as a post-test. And then also we have a study plan included in the program. And then we have lots of videos to help navigate you throughout the program as well as also study tips. And then there's also quizzes in between some of the modules as well. And then inside of the videos, I try to make them as well as visual as possible. And we really encourage you to finish and go through the entire program. So you're going to find it very informative, very helpful. So this is the RN course. And then inside we have also our LPN program. So with our LPN program, here's a little bit what it looks like. So our LPN program, the moment you get started, you automatically see this video, welcome you into the program. And then the same thing, you're just going to follow it in the direction, the order. We did also create a specific study plan for the LPN program as well. that you'll be able to download and have access to. And then there's over 82 posts throughout the program. There's also cheat sheets and guides. And then also we make them very visual for you to go through and navigate. So you're really going to find it helpful and very informative. So if you want to get started with the course today, what I'm going to do for you, because you watched this video, you want to go ahead and go to the link below this video in the description section and use the code Facebook, or if you watch this on Facebook, or YouTube if you're watching this on YouTube, for 25% off the program. All right, one more time, you're going to use the code Facebook if you're watching this on Facebook, or you can use the code YouTube if you're watching this on YouTube on the checkout page to get 25% off the program. Now, this is a limited time offer, so it could disappear anytime. So go ahead and take advantage of it today through the link. And it only works on the plan, so it doesn't work on the trial. So if it's a free trial option, it's not going to be active on there. All right.